Well, I'm excited to offer you an overview of the Medicare program. Maybe some common pitfalls that you need to avoid and a review of the important changes for the year. But before we get started, let me introduce myself. A lot of you already know me because I am in Andy's cohort, but I am a licensed independent health advisor, and we moved to Texas in 2020. I partnered with a large brokerage in 2021, and I basically help people educate with people with their Medicare options. So there's no cost for my services, and I represent a national brokerage that has over 100 carriers. So currently I am an AFC candidate, and I also volunteer some of my knowledge in our local military nonprofit organization on base here. So I hope to share some of my knowledge in Medicare with all of you today, and hopefully you can take some of that information to share with others that may benefit from it. So now that you know who I am, I'm excited to talk to you about everyone's favorite topic, Medicare. Whether you have clients who are under 65 and exploring Medicare, or they are new to Medicare, or they're already on Medicare, this presentation can give you a basic understanding of what Medicare is, what they need to know, what it covers, when to enroll, how much it costs, and what if your clients can't afford it? Are there other options? So let's start with the first question. What exactly is Medicare? Well, it's a government health insurance program, and it serves three groups of people. It serves people over age 65, people under age 65 with certain disabilities, and people with end-stage renal disease. It is administered by the Centers for Medicare and Medicaid Services, also known as CMS, and it works closely with the Social Security Administration who enrolls the railroad retirees. I want to dig a little deeper into the history of Medicare, but it's interesting to learn about the history. It started back in 1945 with President Truman. He was proposing a comprehensive insurance program from people through Social Security, but it wasn't until 20 years later that something actually came about when President Johnson signed into law Medicare and Medicaid. Medicare being for people over 65 and Medicaid being for people with the lower income. President Truman was the first person to enroll in Medicare. Later on in 1972, disabled persons and those with end-stage renal disease were able to be provided Medicare coverage as well. And then due to the coverage gaps in original Medicare, Medicare supplements offered a way to bridge those gaps and minimize out-of-pocket costs. Then in 1980, the government took insight of those programs, and in 2005, we all see those commercials that Medicare created another program, and they contracted with private insurance companies to do it. The goal was to create a more comprehensive, coordinated approach, so they came up with Medicare Advantage, also known as Part C. And I'll talk more about those in general. We'll see how those different options work for you. So let's get started with the alphabet. Hopefully by the end of this presentation, you will know the alphabets of Medicare. There are four main parts to Medicare. And what they are, I'll discuss parts A, B, C, and D, what they are, what do they cover, and how they work together. So you'll see this slide about 2 more times, and when you see this slide, you'll know that you'll have a pop quiz. So there are 2 ways Medicare beneficiaries can get Medicare. On the left is original Medicare with parts A and B, and you can add a Medicare supplement and also add a separate standalone prescription drug plan. On the right-hand side is the newer way to get Medicare, which is the Medicare Advantage, or Part C. This combines Part A, B, and usually includes a built-in drug coverage. Some Medicare Advantage plans don't have to include drug coverage, and in that case, you can add a standalone. So who qualifies for Part A and B? Anyone over 65, as I mentioned earlier, anyone under age 65. If they are under age 65, they need to have Social Security for at least 2 years. Anyone with end-stage renal and in this case, their Medicare would start on the first month of the birth month. Let's say they turn 65 on the 1st. Well, then Medicare would start the month prior to that month on the 1st. And if they have disability benefits, Medicare will become effective on the 25th month of disability. So what if your clients are still working or not receiving Social Security or railroad retirement benefits? Well, they need to sign up for Medicare through Social Security. It's not automatic. And so you want to make sure they apply 3 months before turning 65. Some important things to note about Part B is that if they have coverage through their employer or their spouse's employer, they may want to delay getting Medicare Part B, because that's an extra premium that they have to pay for. However, I would always recommend they should check with their benefits administrator of their employer before signing up. It's very important to note that if they retire or lose group coverage and need to get on Part B, they need to be sure to do it right away by informing Social Security, because a delay could cause a 10% penalty for them for every 12 months that a Medicare beneficiary was eligible but did not sign up. So just some important things to note about the penalty. So there are 3 Medicare enrollment periods. One surrounds your 65th birthday month. It starts 3 months prior to 65. It includes your birth month, and it includes 3 months after that. So that's your 7-month window. The second enrollment period applies to people who are retiring or losing employer-based coverage. That is the special enrollment period. It's about 8 months long, and it begins the months after that person retires. So if they miss an enrollment period, there is a general enrollment period. And that's the first 3 months of every year, and your Medicare would become effective on July 1st. So it would be from January 1st to March 31st, which is the general enrollment period. Again, keep in mind that 10% penalty for every 12-month period you were eligible but did not enroll. So let's talk about Part A. Some people like to think of A for admissions to trigger some of your memory, just Part A, hospital, or A for admissions. This relates to hospital inpatient related services, rehab centers, skilled nursing facilities, hospice, home health care, and blood. I put a note here that long-term care is not covered through Medicare. So just something to think about when you're talking to your clients, that extra cost. Insurance coverage generally has a premium. Well, for Part A, there is no premium. If you or your spouse paid Medicare taxes while you worked for 10 years or at least 40 quarters, those were the FICA taxes that you paid. So when you get on Medicare, Social Security sends those dollars to Medicare. But let's say you didn't pay the 10 years of FICA taxes. Well, you still have the option to get Part A by paying a premium. And right now in 2024, the premium can be as high as $505 a month. Oh, yes, I see Andy here.
There was a question about a slide and a half ago. 10% of what cost?
Okay, so for the penalty is 10%. Let's go back to the slide.
There, right?
Okay, so when you turn 65, if you don't apply for Social Security when you turn 65 and you don't have credible coverage like an employer group coverage, that 10% penalty is for every 12-month period you were eligible but did not enroll. So the cost of the plan that you enroll in.
Okay.
So let's see. Typically, the premium can be as high as $505 a month. So it's important that if you're working with Social Security clients, that you can help them get on ssa.gov. And when you're doing some planning, take a look at how many credits they have already, just to keep them in mind that, you can usually get Part A for free if you've had 10 years or 40 quarters. Otherwise, they could be paying a premium for Part A if they don't have enough working years. So there are costs associated with Part A. In 2024, the hospital deductible is $1,632. That's a lot. That's for each benefit period. 60 days is a benefit period. You must first meet this deductible before original Medicare kicks in. So benefit period of 60 days, you can have at least 6 times in a year. But it's really challenging if someone had a bad health year and they were in the hospital for over 60 days, they could have a copay from days 61 and 90 of $408 per day. And if they were in the hospital for over 90 days, the cost goes up, and that could be up to $816 per day. The way that original Medicare measures your use of hospital and skilled nursing facilities, a benefit period begins the day you're admitted as an inpatient in a hospital or skilled nursing facility, and the benefit period ends when you haven't gotten any inpatient hospital care or skilled care in a nursing facility for 60 days in a row. So if you go into a hospital or a skilled nursing facility after one benefit period has ended, a new benefit period begins, and you must pay the inpatient hospital for each benefit period. So there is no limit to what you could owe out of pocket. Sounds a little scary, doesn't it? So let's go on to Part B. B, I'd like to think of this for Band-Aids or outpatient care medical services. This can include things like doctor services, outpatient care, home health services, preventative, DME, durable medical equipment, hospital services, physical therapy, and transplant immunosuppressive drugs. So in 2021, several new coverage items were added. Acupuncture for low back pain, telehealth visits were the new ones after COVID, and then virtual check-ins for follow-ups. This coverage is limited, but these are the new items that were recently added to Medicare coverage. So there is a premium for Part B, and for this year it is $174.70. So those with higher incomes, based on your IRS tax report 2 years ago, is how they base the income for Part B if you have higher income. People with limited incomes who are receiving assistance will pay a lesser amount based on the level of assistance they are receiving. Also, there is some help that could pay for this Part B premium, and that's called the Medicare Savings Program. If you have any questions about that later or how to apply for it, I can definitely discuss that. But there is a 10% penalty, again, I have to stress, for every 12-month period for someone eligible but didn't enroll for their Part B. So there are additional costs. You must pay the $240 deductible before Part B kicks in, and that's one time per year. So clients have to save for this amount each year. Medicare pays 80% of the approved charges, and the Medicare beneficiary is responsible for 20% of the remaining costs. There could be excess charges over and beyond Medicare approved amounts. So there's no ceiling to the amount you could owe out of pocket. So as you can see, Medicare doesn't cover all costs. And if you're like me, I don't want to pay those high copays or have potential financial risk. That's why it's important to find out if clients have any additional coverage beyond original Medicare.
All right, we got a couple questions on Part B.
Okay.
Is the Part B premium per month? Because it said 174. Was that annual or is that monthly?
No, that is the $174.70 is monthly. So we have to times it by 12. But you can opt with Social Security to have it deducted monthly or quarterly if you'd like.
Okay. And what might be considered high income for Part B?
So there are brackets for each year, I believe, less than 89,000. But you have to have more than 100. I believe it's 189,000, but I have to double check that on the booklet. So there is a high income, a bracket amount that we'd have to double check for each year.
And I'm sure it changes on a regular basis. So
it does, yeah. So I can definitely look that up and get back to you on that. I should have put the chart here, but normally it's over 100. I know it's over 130,000. So let's see.
And then two more. What is a good baseline for Part B income?
What is the income change? What is a good baseline for? So the standard, I believe, is under 89,000. So if you are making under 89,000 for your income 2 years ago, then you would be paying the standard. And if you made anything higher than that bracket, the brackets go up. So I've seen as high as $350 to $500 a month based on those brackets. And I can just post it on the chat at the end of this session on where you can find that.
Oh, Taylor shared.
Oh,
Thank you.
Yeah, it's on SSA, it's on Medicare.gov. It's also on the Medicare booklet.
Yep. And what is the high income changes after 2 years?
Well, Medicare puts that out every year, so we wouldn't know until they publish it. Okay. Any other questions?
That's good.
All right. So I'm going to go into Medicare supplements, also known as Medigap. So this is a supplemental health insurance in addition to original Medicare, which is A and B. So this will cover, this is a gap coverage, I like to say. It covers some or most of the gaps that Medicare doesn't. So that 80-20 I talked about earlier, that'll cover that 20%. Things like deductibles, copays, and coinsurance. And it's provided by private insurance companies. So you kind of might wonder why I have the illustration of apples stacked up. It's because Medicare regulated the plans and created a standardization of the plans. That way you can compare apples to apples and see how they stand up next to each other. So I wanted to show you a little chart here of what Medigap plans would look like when you're comparing them side by side. I know this can look overwhelming, but I want to highlight a few key important points when you're looking at Medigap plan. So this is everything that a Medigap plan would provide. These are the services. You'll see that it has Part A coinsurance and hospital cost, Part B coinsurance copayment, your blood for first 3 pints, hospice care, skilled nursing facility, the Part A deductible, Part B excess charges. The most comprehensive plan prior to January 1st, 2020 used to be a Plan F. And if someone applied after January 1st, 2020, they now can get a Plan G. The difference between the Plan F and G, this is the most comprehensive coverage, is that deductible there. Mentioned earlier that you were responsible for that $240 deductible before the Plan G will kick in. So after that, your Plan G covers 100% of these services. So please don't be confused with plans A through N on the alphabet. It is not Part A, B, C, or D at all for Medicare. So these are Medigap plans. The cost for Medigap plan can range from a premium of around $100 a month. And the monthly premium is paid to the insurance company that you choose. But you'll need to continue to pay the government for your Part B. And it can vary in costs depending on the plan that you choose, where you're located, and how old you are. The premiums can go up over time, and they usually go up about 3 to 6% depending on the claims ability of the carrier. And you can compare this Medigap policies because the cost can vary. So if you decide you need to change plans because the premium has gotten too high, just keep in mind that health underwriting is usually required to change the plans. So when you're getting a Medigap policy upon your initial enrollment period, you are guaranteed issued. But any other time of the year after 65, you will have to go through some general underwriting questions for a Medigap policy. Okay, so enrollment 6-month period to apply for Medicare supplements. It begins on the first day of the month you're 65 or older and enrolled in Part B. If you delay enrolling in Part B because you have group health coverage based on your spouses or your employment, the open enrollment period won't start until you sign up for Part B. So again, I mentioned that guaranteed issued privilege. It means that you can't be denied for coverage or charged more due to health conditions. So even if you delayed your coverage because of your employer or your spouse's employer, you still have that 8-month window and be guaranteed issued. So you could be 70 years old, still working up to 70. There are limitations. Generally, it does not cover long-term care in nursing homes, vision, dental care, hearing aids, eyeglasses, and most do not cover any prescription drugs. So they likely won't need to add a standalone. So you'll likely need to add a standalone prescription drug plan. Okay, so pop quiz. Do you still have to pay your Part B premium? And you can just put this in a chat. If you have a Medicare supplement. Okay. I see a couple yeses. You guys are all so smart. Yes, because in order to have a Medicare supplement, you must have original Medicare, which is Part A and Part B. So we talked about the first way that Medicare beneficiaries receive Medicare, which is to enroll in a original Medicare with a supplement plan and a separate Part D prescription drug plan. So think of original Medicare with a Medicare supplement as a pay now system. But let's discuss the new option, which is Medicare Advantage, which includes Part C and usually Part D, which is drugs. Think of it as a pay later system. And let's talk more about why it is a pay later system. Oh, and one thing to mention, you may have clients who come to you saying their Medicare supplement premiums have increased and are costing them around $250 a month. Sorry, I didn't mean to say $250,000. But once you pay that, all you face is the Part B deductible. And Medicare Advantage plans can have zero premium, but they can face higher out-of-pocket limits. That could range from $3,500 to $4,500 with an HMO plan, or up to $9,500 for a PPO plan. So if you do the math, let's say someone has a Medigap policy, which is a Medicare supplement, $250 a month times 12, that's what, $3,000 a year. It's important to remember that everyone's situation is different. So a husband and a wife don't have to be on the same plan. One may be very healthy, taking no medication, and another has decided to go with a zero premium with Medicare Advantage. But the spouse may have different doctors, specialists, and so it just all depends on their situation when you're thinking about those plans. Okay, we'll dive into Medicare Advantage Part C. Medicare Advantage Part C. Companies who offer Medicare Advantage plans are contracted with Medicare. The company pays a claim rather than the government, and Medicare still approves the plan, but the plans change each year. So these can get very complicated. So I highly suggest working with a licensed agent who can show you all the plans. Most of these plans, again, do include coverage. You must continue to pay Part B premium. Some have deductibles, coinsurance, and co-payments. Some can range from oftentimes zero, and they can have low to no deductibles. They have coverage built in. There's predictability because there's care coordination with doctors. There is an annual out-of-pocket max. So something to keep in mind that, if you've had a bad year, just know that there is a cap on the plan, and the plan pays the rest once you reach that cap. And another benefit is the additional dental, vision, hearing supplement that you may have. Other plans may include other things like a grocery card. So there are different types of Medicare Advantage plans. I won't go too much into this, but the Health Maintenance Organization, we all know that it's in network, or you must stay in a provider network in order to get benefits. A PPO, you can save you money if you stay in network, but you can also go out of network when you have a PPO plan. So also one thing to keep in mind with an HMO, you might have to get a referral to see a specialist. So we have other plans as well, special needs plan, and those who are veterans can have an MA only plan, which is a Medicare Advantage only plan with no drug coverage. Who can generally join a Medicare Part C? You must have Part A and B again. You need to reside in your service area. So keep in mind, this type of plan, Medicare Advantage, if you move to a different state, you're going to have to reapply for another Medicare Advantage plan in that state if it's available. The update in 2021, people with end-stage renal disease, patients can enroll in this plan as well, but you can only belong to one Medicare health plan at a time. You may not have a Medicare supplement and a Medicare Advantage plan at the same time. So prescription drugs, our last letter of the alphabet, Part D, think of drugs, D for drugs. So they're run by private insurance companies. The plans change every year. And there are really two ways to get coverage. You can either get it through the standalone plan or built in through a Medicare Advantage plan. Again, you need to have Part A and Part B. You need to live in the plan service area. You must be enrolled in the plan to get coverage, and you can't live outside the US or be incarcerated. So there are premiums for Part D, and they vary by the plan. So you can pay as low as $8 a month up to $155 a month. One thing I want to note here is you may owe a Part D late enrollment penalty of 1% of the national base beneficiary premium if you for any continuous period of 63 days or more after your initial period is over. So for each month you were eligible and did not enroll, they're going to the base beneficiary premium. So in 2024, $34.70 is the base premium. Unless you had creditable drug coverage. I see this a lot with people that have a TRICARE, retirees, military retirees. They don't get that penalty because they have drug coverage. It's creditable coverage. The cost can vary by plan. Each plan has their own formulary, and in that formulary, the drugs are placed in tiers. Tier 1 being the most affordable, tier 5 and 6 could be the most expensive. Those are things like your cancer medications and things like that. But something new that came up was 2021, they introduced a Part D senior savings model in the Medicare Advantage plans, and that's a $35 cap on copays for different types of insulin available with those types of plans. Okay, so there are costs related to Part D, and that includes your premium, unless it's included in the Medicare Advantage plan. So if you're paying a standalone Part D, there is a premium, and that can range from $0 to $545. There are different stages, and you'll usually meet the deductible if there is one, depending on the plan you choose. Then you'll go into the initial coverage stage where you're paying a certain copayment or coinsurance. If you have more drugs over time throughout the year, you'll then reach what's called a donut hole. And that donut hole has actually gotten better over time. Today, in the donut hole, you pay 25% of the covered drugs until you reach a threshold of $8,000. Once you reach that threshold of $8,000, you get into catastrophic phase, which is usually the last phase of Part D. And that's where Medicare pays 100% of the drug cost. And so only about 3% of Medicare recipients reach this catastrophic phase. You know, they constantly get new drugs every time. But just note that there is extra help for those with limited income to help cover a majority of these costs. And you can actually find that on ssa.gov/extra help. So this is this is an 8,000 cap per year. Oh, the question was, is the 8,000 cap per year or lifetime? No. This is every year. Every year. It restarts every year. So what about, oops. Pop quiz. Can someone have a Medicare supplement and a Medicare Advantage plan at the same time? Okay, Cynthia says, no. That is correct. You cannot be enrolled in a MedSup and a Medicare plan at the same time. So last final review on this slide. You want to, if you have clients who have limited income or resources, they can get help from the state to pay Medicare costs. And full eligibility covers Part A and or Part B premiums. So if they get approved for full qualified Medicare beneficiary status, they automatically qualify for extra help with their drugs. And I do have a copy of the Medicare program savings application you can usually find on your state's website. I'm happy to email that to you. Lastly, I wanted to go over what about other out-of-pocket expenses that maybe they may have. One of the greatest concerns for seniors today, especially if they're on a fixed income, are things like if they were hospitalized, they can be stuck by paying the amounts not covered by Medicare and Medicare Advantage. Usually a hospital indemnity plan can cover that. When planning for expenses, they have other things like general vision or hearing. There's things like final expense versus burial expenses. Many will seek out burial plan with a local funeral home to take care of that, and this may work for some, but there are truly some differences to consider when deciding between a final expense plan versus a burial expense plan. So also very important to note that long-term care is not covered by Medicare, Medicare supplements, or Medicare Advantage. So you want to be sure to find out about any long-term coverage they may have, or anything other than in place that they may have saved up. Okay, so here are just some tips that Medicare beneficiaries should know. I think I have one more slide after this. Does your selected plan meet your personal and financial needs? Should you choose to travel, will the plan provide adequate coverage? Do you understand the prescription drug formulary, and does it cover your medications? And is your plan accepted by your physicians and specialists? Other things to consider when choosing an insurance agent to work with: are they independent or are they captive? Because they can give you more options. Do they have experience with the plans? And do they take time to verify your whole situation, your whole healthcare situation? So I'll leave you with what I call the 3 C's of Medicare. Medicare is complicated, and because of that, it's confusing. And because it involves your health, it's concerning. So I hope this information that I've shared with you today is helpful to you or your other clients in their retirement years. One of the biggest problems is at age 65, people think they're set and they don't take a look at this situation. They have to figure out what to do about Medicare and come up with a plan. So recommending to clients, start doing their research earlier than 65, a couple months or a year prior to. People think they're just going to get what their other spouse has or what their best friend got because it works for them, but it may not be the best option because they may take different medications. They may not see the same doctors and they may not have the same medical issues. So each person needs to make their own decisions for their plan. And you'll see here on the right side, this is the Medicare New booklet. It's mailed to each beneficiary that becomes eligible for Medicare. So you can also let your clients know to request a copy online on medicare.gov and ensure they are comparing options. If you have any general questions,
I have two that are in the chat that we're going to go through. Okay. TRICARE for Life, people on TRICARE for Life, they automatically become, Medicare becomes primary at 65, correct?
Yes.
Okay. And since many of my clients
and also for
retirees from the military, how do the costs change when you combine Medicare with TRICARE for Life?
So with TRICARE for Life, TRICARE for Life essentially acts like a Medicare supplement, okay, to original Medicare Part A and B. So I wouldn't mess with, if someone has TRICARE, it's different from VA benefits, okay? Because when they have TRICARE for Life, that's already like a Medicare supplement, since they're getting original Medicare and they're getting TRICARE for Life. If they decide they wanted a Medicare Advantage Part C, they can still get that because they want to see doctors out of network and not have to deal with the VA. They can still get that. But I would always recommend an MA only because then it doesn't mess with their drug coverage with the military. So the MA only just allows them, the Medicare Advantage only just allows them to go out of network to see doctors out of network if they're not using their military benefits. But for someone who has TRICARE for Life, a lot of times I would say it acts just like a Medicare supplement.
Thank you.
It covers the secondary.
All right. They can't switch back if they have one of the other, they can't switch from one plan back and forth, right?
So when you turn 65, you have that initial guaranteed enrollment period. If you decide that you wanted a Medicare Advantage plan during your initial enrollment period, you have what's called a 12-month trial right. You can use a Medicare Advantage plan for 12 months or up to 12 months. And during that time period, you can decide to go back to a Medicare supplement if that's what you enrolled before. So if they switch from a Medicare supplement to a Medicare Advantage, they want to go back, they have a 12-month period to go back.